Welcome to Health Code Blueprint, where we break down complex clinical coding concepts into clear, practical guidance for everyday use. Today's session is Anemia Coding, a visual handbook designed to help you understand anemia classification, documentation requirements, and ICD-10-CM sequencing rules with accuracy and confidence. Before we begin, here is our disclosure. This presentation is for educational purposes only. It does not constitute legal, compliance, or billing advice. Always follow official ICD-10-CM guidelines and organizational policies. Anemia is defined as a lower than normal number of circulating red blood cells or reduced hemoglobin, which decreases oxygen delivery throughout the body. As the document states, anemia is rarely a standalone disease. It is a signal to search for the root cause. This is the coder's mindset. Anemia is often a symptom, not the final diagnosis. Accurate coding requires identifying both the type of anemia and the underlying condition driving it. Common symptoms include fatigue, weakness, dizziness, and shortness of breath. The first category includes iron deficiency, B12 deficiency, and folate deficiency anemias. Iron deficiency anemia, D50.0 to D50.9, requires attention to documentation. D50.0 is used for chronic blood loss, while D50.9 is unspecified. Vitamin B12 deficiency, D51.0 to D51.9, requires identifying intrinsic factor deficiency or dietary causes. Folate deficiency, D52.0 to D52.9, may be dietary or drug-induced. The guide emphasizes, avoid D50.9 if the clinical documentation indicates the specific cause. This category includes anemia caused by chronic conditions. Anemia of CKD, D63.1, must always be paired with the CKD stage, N18. Anemia of chronic disease, D63.8, is used when anemia is due to systemic illness other than CKD. Chemotherapy-induced anemia, D64.81, is linked to antineoplastic treatment. The document notes, anemia of chronic disease and anemia of CKD are distinct codes. Check the etiology carefully. This category includes sickle cell disorders, hemolytic anemias, and aplastic anemias. Sickle cell and thalassemia, D56, require type and subtype specificity. Hemolytic anemias, D58 to D59, include autoimmune, enzyme deficiency, and drug-induced types. Aplastic and pancytopenia, D60 to D61, require an additional code for the underlying cause when known. The guide highlights, specificity is key here, distinguish between congenital versus acquired conditions. Certain documentation terms directly influence coding, due to indicates a causal relationship and requires coding the underlying condition first. With implies an association unless documentation states otherwise. In means in the setting of, and is treated similarly to with. The document states, code the underlying condition first, when causality is documented. Anemia coding follows a clear order of operations. Code the underlying etiology first, such as malignancy, CKD, or blood loss. Code the anemia as the manifestation. The guide explains, the sequence tells the story of the patient's health. Cause and effect. Understanding excludes notes is essential. Excludes 1 means the two conditions cannot coexist. Excludes 2 means the conditions may coexist and can be coded together. The document warns, misreading these notes is a leading cause of claim denials. The coding process begins with one question: why is the patient anemic? If the underlying cause is known, code it first. Then identify the specific anemia type: iron, B12, folate, hemolytic, or aplastic. The guide reinforces, always answer why is the patient anemic, before answering, what kind of anemia is it? Here we'll dive into the application of the guidelines, starting with this example. A patient presents with iron deficiency anemia due to a GI bleed. Coding this as D50.9, unspecified iron deficiency anemia, would be incorrect. As the document states, why it's wrong, it ignores the known cause and uses a vague code. The correct approach is to link the anemia to its etiology using D50.0 plus K92.2, which captures iron deficiency anemia secondary to blood loss and the GI hemorrhage itself. This reinforces the core principle: when the cause is known, specificity is required. Another example includes a patient with stage 4 CKD and normocytic anemia. Coding only D64.9 or only N18.4 would miss the clinical relationship between the two conditions. As the document explains, the code first note requires the CKD stage to be documented alongside the anemia manifestation. The correct coding is D63.1 plus N18.4, which captures anemia in CKD and the specific CKD stage. This example reinforces the importance of pairing the underlying condition with the anemia to tell the full clinical story. Before we wrap up, it's helpful to pause and look at the mistakes that show up most often in anemia coding. These red flags are patterns that can lead to denials, inaccurate data, or incomplete clinical representation. The document highlights several pitfalls coders should watch for. Overusing unspecified codes like D50.9 when documentation clearly identifies the type of anemia is a common issue. Another is coding anemia of CKD without including the corresponding N18 code. Excludes note violations, such as pairing autoimmune anemia with D63.1, can also cause errors. And finally, failing to specify whether a condition is congenital versus acquired, or acute versus chronic, leads to loss of clinical detail and coding accuracy. To bring everything together, this final slide summarizes the core principles that guide accurate anemia coding. These points reflect the patterns we've seen across the classifications, sequencing rules, and case studies. The key takeaways include determining whether the anemia is acute or chronic, primary or secondary, identifying the underlying cause whenever possible, using additional codes to capture associated conditions, and avoiding unspecified codes when documentation supports greater specificity. These steps ensure that the coding accurately reflects the patient's clinical picture and aligns with ICD-10 CM expectations. Thank you for watching, and I'll see you in our next video.